And good. Okay. Hi there. Close the door and room for and the curtain for privacy. My name is Allie. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Michaela, unders 5'11", 99.
All right, Michaela, do you have any allergies?
Amoxicillin.
All right, I'm going to check your wristband. It looks good, and I checked the MAR, and that also looks like it is correct. I would use hand sanitizer. And I don't need gloves for this procedure at all. So, looking at your orders, it looks like we have an order for a head to toe assessment. So I'll walk you through everything, okay? So first, I would start by taking your apical pulse. So I would find your sternal notch, go to your angle of Louis, go mid-clavicular level, and then go down 5 intercostal spaces, where I would listen for 60 seconds to your pulse, and I would make sure that there's no dysrhythmias and no brutes or no like anything abnormal. And we'd want the rate to be between 60 to 100. Next, I would do your blood pressure. So, with your blood pressure, I'd make sure I have the correct cup size. So we want it to be 2/3 of your arm. I would roll up your sleeve farther, or I would have you take it out.
Yeah,
but it's fine. 2/3 of your arm, and the bladder covers 80 to 100% of your arm width. I would then use the 2-step method. So the 2-step method, I would listen to your brachial pulse. I would pump up the blood pressure cuff until I can't feel your pulse anymore. Then I would go 20, I would add 20 to that number, and then I would take your pulse like normal, or your blood pressure like normal. So I would listen and pump it up and listen. So normal blood pressure is 120/80. If it were high or if it were low, I would ask you if you had a history of high or low blood pressure. And then I would also let you sit and retake it. And if it was still high or low, I would notify the provider. So moving on then to starting at your head, to your hair and your skull. Hair, looking at the distribution, looking at the color. Making sure that there's no lesions within the hair, that it's not excessively oily, that the skull is symmetrical, and there's no infestations. So that all looks good. Next, moving to your facial features. Looking at your face, I am making sure that your ears and your eyes are symmetrical, that your nose is midline, and so is your mouth. And then I'm going to take a closer look at your nose. I am going to make sure there's no visual lesions on the outside. I'm going to take a look inside. Once again, looking for any lesions, abnormalities within the nasal cavities. I'm going to have you close one of your nostrils and breathe in. Good. And then do the same with the other. Good. Checking nasal patency, ensuring that you can breathe out of both. And then I'll do your sinuses. So your maxillary sinuses, your frontal sinuses. Any pain there at all? Any tenderness? No? Okay. So those look good. Moving on to your mouth, inspecting the outside, making sure that it is midline. The exterior lips are pink or red. And then I'll have you pull down your bottom lip. Looks good. So your bottom lip, the inside of it is going to be moist, is going to be pink in color. Also taking a look at your gums, making sure they're not red and inflamed. That would be a sign of gingivitis. So those look all good, no irritation at all. Can you smile at me? Looking at your teeth are white. There is no missing teeth anywhere. They all look sturdy and healthy. Can you open your mouth, stick your tongue out, and then lift your tongue up and from side to side? Good. So the top of your tongue is rough, like it should be. The bottom, the attachment point is nice and sturdy and pink. Looks like there's no signs of irritation or fungus anywhere. Can I have you open your mouth, stick your tongue out at me? Looking at the tonsils and the oral pharynx. Those look good. They look intact. And no sign of irritation there whatsoever again. So next, moving on to your skin, assessing the color of your skin, that it is uniform to throughout and it is normal color to your race. Looking at the skin turgor, making sure that it falls back, which it does. Your nails for capillary reflex, or capillary refill, making sure that your nail beds come back to normal color within a reasonable amount of time, that your nails are convex, and that they're pink in color. I'm also going to take a look, I'm going to assess for edema, looking at your lower extremities, since that is where it's most common. And if there were edema present, I'd have to rate it on a scale from 1 to 4. So +1 would be 2 millimeters, it would sink in. +2, it would sink in 4 millimeters. +3, 6 millimeters. And +4, 8 millimeters. So I do not see any edema present. I'm also going to take a look at your veins, making sure that there's no inflammation of your veins anywhere in your body. So those look good. All right. And then for musculoskeletal, we're just going to go right into that. I'm going to feel your joints, making sure there's no pain, no temperature changes, nothing, no abnormalities, that they all seem intact, so they look good. So now I'm going to assess your muscles. So I'm going to apply some resistance. So we're going to start with your sternocleidomastoid. So can you turn your head towards resistance, and that way too? Good. Have you shrug your shoulders, your trapezius? Good. Arms out, deltoid. Good. And then you can put your arms back in. Show me your muscles. For your bicep and tricep. I'll do it on this side too. Bicep, tricep. Good. Let me see your hands. For your wrists. Good. Hands spread out. Don't let me close them. Good. Grip strength. Good. All right. And then adduction. Abduction. Good. Hamstrings. Quadriceps. Those seem good. And then ankles for dorsiflexion and plantar flexion. So your muscles all seem strong, intact. No signs of any pain anywhere. I'd also, with your skin, I would also note skin lesions. So like here's a papule, moles, which are normal for this patient. But I would also make sure to keep an eye on them to make sure they don't grow or become an abnormal shape. So, moving on to your eyes. Do you have a history of an eye astigmatism?
Yes.
All right, so I would notify that in my findings, and I would also make sure that I check that with her records. Have you ever had any blurry vision?
No.
And do you wear contacts?
No.
Or glasses? Good. All right, so I'm just going to assess the outside. I am inspecting the outside of your eye, making sure that your eyelashes are equally distributed. Can you close your eyes? Looking for any lid lag, any irritation with the ducts, which they look normal, so that looks good. Your sclera is nice and pearly white, and then I'll have you pull down Good. And your conjunctiva is pink. There's no signs of irritation or redness. Well, that looks good. I'm going to test your, I'm just going to assess your pupil reaction. So I'll have you look straight at my nose. I'm going to flash a light in. I'm just making sure that your pupils constrict. Good. Good. And I'm going to look at the opposite one. Good. One more time. Good. All right. So those look good. They constrict and dilate together and at a normal rate. Next we are going to, I'm going to test your peripheral vision. So I'll have you close or put a hand over one of your eyes and let me know when you see my finger, okay?
Yeah. Okay. Yep. Yeah.
Okay, and switch eyes.
Yep. 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 Yeah.
All right. So peripheral vision looks good, normal, which is great. There seems to be no, nothing abnormal going on. So next we're going to do pupil accommodation. So I'm going to have you look closely at my finger, and when I drop my finger, I'm going to have you look straight ahead, okay? Good. So it's just making sure that her eyes constrict when they're looking closer and dilate to let more light in when they're looking farther away. And then finally, our last test, I'm going to have you follow my finger with just your pupils, okay? Looks good.
I have an eyelash.
So her 6 cardinal directions are good. There was no shaking with her eyeballs, and they both followed my finger equally. So that's good. Moving on to your ears. Do you have a history of tubes in your ears?
No.
How about a history of ear infections?
No.
Any pain?
No.
Okay. So I'm just inspecting them from the outside, making sure that they are symmetrical. Inspecting the external ear. I'm going to fold the pinna, push on the tragus, the mastoid process. Any pain there at all? No? Okay. So then next I would take out my handy dandy otoscope and I would look inside, making sure that there's no cerumen present, and that her tympanic membrane is either pearly white, pearly gray, or translucent. And I would look in both ears. So next I'm going to do a hearing test on you. Just going to make sure that you can hear. When you hear, or let me know what ear you hear my fingers rubbing at, okay?
Right. Left. Right.
Left. All right. Good. So your gross hearing is great. Oh shoot. Backing up to the eye exam, I forgot to like assess your near vision by reading. So I'll have you read.
Generic name.
Perfect. That was my bad. So, all right. So then your ear assessment is done. Moving on to your neurological. So your neurological, I'm going to start by assessing your level of orientation and consciousness. So you told me your name. Do you know what the date is today?
October 6th.
Okay. Where are we?
Your house.
And how'd you get here?
I drove.
Okay, perfect. So she's very oriented to herself, time, place, and how she got here. Next, we're going to assess memory. So I'm going to do short-term memory. So I'm going to give you 3 numbers, and I'll have you repeat them back to me. 3, 5, 7.
3, 5, 7.
And can you repeat them backwards?
7, 5, 3.
Perfect. So that's good. She also told me her recent memory, how she got here, and then her relevant memory she said at the beginning of the assessment with her birthday. So now we're going to go into assessing the cranial nerves. So I'm first going to have you close your eyes. We're going to assess your olfactory. So I'm just going to have you tell me what you smell.
Alcohol.
Perfect. So your olfactory is good. Your optic, we tested with the reading material. Your oculomotor, trochlear, and abducens, we tested with your 6 cardinal directions. Your trigeminal, can you open your mouth and move your jaw from side to side? Perfect. Your trigeminal is working. Your facial, can you smile and frown? Okay, so your facial is working as well. Next is going to be your acoustic or auditory, which we tested with your hearing, your gross hearing test. Next is the glossopharyngeal and vagus. Can I have you stick your tongue out at me? Move it from side to side. Good. All right, so that's good. Your hypoglossal, which can you say DLNT?
DLNT.
Good. And then your accessory, which I'll have you shrug your shoulders. Perfect. All right. So next, I'm gonna have you assess. I'm gonna assess your fine motor skills. So can you touch each finger to your thumb? Good. All right, and then your Babinski reflex. So I'm just gonna make sure that there should be no reflex, no flaring of the toes in an adult. Good. And if it was an infant, I would want to see flaring of the toes. So that is good. Moving on to respiratory. Do you have asthma?
No.
Do you have a history of pneumonia?
No.
And do you have any trouble breathing?
No.
So throughout the assessment, I was assessing her breathing, and she was breathing effortlessly, so that is a good sign. I am just going to palpate her thorax, her anterior thorax, and her chest. Good. And then your posterior. Good. And now I'm going to feel for your chest excursion. Perfect. So my hands both rose and fell at the same time, so both lungs are working correctly and together. I'm also going to assess your AP lateral ratio, making sure that she's not barrel chested. If she is barrel chested, I would be concerned a little bit of COPD. So that looks good. And then now I am going to listen to your lungs posteriorly. So I'd obviously do this underneath clothing, and I'm going to listen with my diaphragm. Let me take a deep breath in. Good. All right, So those sound good. Your lungs, there seems to be no crackles, no rails, anything abnormal that way. Um, they sound clear. So I'm gonna have you stand up and touch your toes. I'm assessing for scoliosis, kyphosis, and lordosis. And I would have also done this in the musculoskeletal assessment. And also in the musculoskeletal assessment, I would have had you take 5 steps that way and turn around, come back, assessing your gait and your balance, which looks good. So now back into your lung assessment, I'm going to asculate your anterior lungs, listening that way. Deep breath in. No. So those also sound clear, and confirm my readings of no crackles, rails, or any fluid buildup in those lungs. So they sound good. Any questions about your respiratory at all? No? All right. Moving on to your cardiovascular. So with your cardiovascular assessment, I am going to start by, do you have any heart pain?
No.
Do you notice any swelling in your lower extremities?
No.
And then do you have a pacemaker?
No.
Okay. So first I'm going to have you tilt your head to the side. I'm going to assess for jugular distension. The other side. So just looking at the jugular vein, making sure there's no visible pulsation. If there was, I would have her lay down on the bed, and I would elevate the head of the bed to 45 degrees, and I would assess it again. If it was still there, I would notify the provider immediately. Next, I'm just going to inspect the precordium, looking for any visible pulsation, which I do not see. So I'm also going to feel that. I'm going to palpate that. And I can feel a pulse. So that's good. That's normal to not see a visible pulsation around the precordium. So now I'm going to listen to your carotids. So I'm going to listen with my bell. Good. All right. So those sound good, sounds clear, and I can hear them perfectly fine. So next I'm going to go into escalating your precordium. I would do this with both sides of my stethoscope, but for time reasons, I'm just going to do it with one side. So I am going to start at the aortic valve. Go to the pulmonic. I'm going to go down to Erb's point. To the tricuspid. And then the mitral. All right. So there was no dysrhythmias present, no brutes. The rate sounded good, nice and strong and healthy. I can hear the S2 sound better at the aortic and pulmonic valves, and then the S1 better at the tricuspid and the mitral areas. So that's good. And finally, so once again, I would do that with both sides of my stethoscope. Finally, I'm going to palpate or feel your peripheral pulses. So temporal, carotid, one at a time, brachial, radial, femoral would be in the groin area, popliteal, I would go underneath clothing, posterior tibial, and dorsalis pedis. So those feel good. They feel symmetrical, even on both sides. So that is a good thing as well. It means your heart is pumping to both sides of your body equally. So for our last assessment, we're going to do abdominal. So I'll have you stand up. I would have you void before this assessment. I'll have you lay on the bed. Okay. First things first, I'm just going to inspect the abdomen, just making sure there's no lumps, bumps, or any abnormalities. I'll have you lift your head just slightly, once again looking for lumps or anything. So that looks good. Next, I'm going to auscultate using my diaphragm. I'm listening for GI sounds. So those sound good. I can hear the GI sounds working, so that means your GI tract is working indeed. Next, I'm going to go into the abdominal, valves to listen to the pulse in the abdomen. So we're going to start up at the aorta. I'm listening with my bell. Aorta, renal, iliac, and then femoral would once again be in the groin area. So those sound good. I can hear them very good in the abdomen. Next, I'm going to percuss. So I'm going to listen for a dullness over the liver and the other organs. Which I do. I hear that dullness over the liver and the gallbladder, which is good. And now I'm going to palpate. So feeling the gallbladder, the liver, for any abnormalities, any bumps, anything else going on. So that looks good. My findings are normal. So do you have any questions, any concerns? Is there anything else I can do for you while I'm here?
No.
No? All right. Thank you.
Thanks.